Every year, thousands of infants face life-threatening emergencies where just a few seconds can mean the difference between life and death. Imagine your baby suddenly choking on a piece of food or becoming unresponsive in their crib. Would you know what to do? In this video, you'll learn the essential steps of baby CPR and choking response, skills that every parent, caregiver, and even older siblings should know. Recognizing an emergency. First things first, how do you know when to act? If a baby is unresponsive, not breathing, or only gasping, it's time for CPR. If the baby can't cry, cough, or breathe while choking, immediate action is needed. Infant CPR for babies under 1 year. Check responsiveness. Gently tap the baby's foot and shout their name. If no response, shout for help and call emergency services immediately. Positioning. Place the baby on a firm, flat surface like the floor or a table. Chest compressions. Use 2 fingers in the center of the chest, just below the nipple line. Press down about 1.5 inches, 4 centimeters, deep. Perform compressions at a rate of 100 to 120 per minute. That's about 2 compressions per second. Rescue breaths. After 30 compressions, cover the baby's nose and mouth with your mouth. Give 2 gentle breaths, each lasting about 1 second. Watch for the chest to rise. Continue. Repeat 30 compressions and 2 breaths until help arrives or the baby starts breathing. Infant choking response. Check if the baby is choking. If coughing weakly, let them try to clear it. If silent, turning blue, or unable to breathe, take action. Back blows. Hold the baby face down along your forearm, supporting the head and neck. Deliver 5 firm back blows between the shoulder blades with the heel of your hand. Chest thrusts. If object doesn't come out, turn the baby face up. Place 2 fingers on the chest just below the nipple line. Give 5 chest thrusts, pressing about 1.5 inches deep. Repeat. Alternate 5 back blows and 5 chest thrusts until the object is expelled or the baby becomes unresponsive. If unresponsive, begin CPR immediately. What not to do. Never perform the Heimlich maneuver, abdominal thrusts, on a baby under 1 year. It can cause serious injury. Never try to sweep inside the baby's mouth blindly. You might push the object deeper. Conclusion. In an emergency, quick and calm action can save a baby's life. Remember, CPR is 30 compressions followed by 2 rescue breaths. For choking, 5 back blows, 5 chest thrusts, repeat until clear. These are life-saving basics, but taking a certified infant CPR and first aid class will give you the confidence to act without hesitation. Share this video with anyone who cares for children, and don't forget to subscribe for more guides that could one day save a life.